So here we're going to show you a technique using instrument-assisted soft tissue massage. We're using this particular tool, it's called a Iastm 6. We can put maybe a link in the description, the local guy if he's still manufacturing these tools. However, you can use any gua sha tool, any other instrument-assisted tool on the market. There are many. If you need any advice for those, send us a message, we'll give you our preferred list. One key thing when you're working with these tools, use a neutral cream. I've seen people use like peppermint creams and like hot, icy cold type creams, and it's not great because if you do break the skin or you get some abrasions and you've got that hot cream on the skin, it can be very painful. So we're going to work Kiki's VMO, the vastus medialis oblique. So this is like the little teardrop muscle you see, like so, and it's one of the quadriceps. It's one of the 4 quads, quadriceps being 4. The job of the VMO is very much to stabilize the knee. When you see people squatting or running and they have this valgus collapse where their knees knocking, that could be a hip issue, of course, it could be a foot issue also, but invariably there's always some sort of VMO weakness. So we're going to use the Graston technique to try and facilitate and increase neural drive and mechanoreception around the VMO. That's why we're using it in this particular technique. So I like to have Kiki's leg angled like so, and all I do, I use the tool and we just scrape at one angle per stroke. So I'm scraping down in this fashion. So what I do with you see we get a lot of cream, it's that itch.
Tickles.
So I just reapply the cream. So it's here, reapply, here, reapply. So right now I'm using just straight stroke, just A to B, boom, A to B, here. So with this, it's like you're combing the skin. You are going to feel some, when you do this, if you have a good tool, you're going to feel some lumps and some bumps and adhesions. That can be connective tissue, it can be deposits of small tiny deposits of fat underneath, it can be like build up of connective tissue also. So I'm going to do the same A to B stroke, like Kiki's going to straighten her knee and bend. Do that for me, straighten, I'll move my hand out of the way, here. So Kiki's doing the work as we scrape. Good. So now what I'm going to do, I'm going to do what they call a J stroke. I'm going to scoop down and then a J. Does that hurt?
Yep.
And J stroke. So I'm going here and scoop. And I'm always staying in and around that VMO area, right guys? So the VMO is this sort of circle here. Well, it's not a circle, it's an oval. So I'm going to go J. J. Okay? So Kiki's obviously reacting a lot to that. Is that painful?
Yeah.
So when it's that painful, we might want to start investo. Remember what we spoke about in the earlier videos, Hilton's law. With this super light stroke, if it's that tender, when we're only really working the skin really, and probably some very superficial connective tissue, if it's that tender, we may need to investigate more deeply into this area. So this is also a treatment / assessment. We're working this lightly. So if she's flinching this badly, I'm going to work lighter, see if I can desensitize the skin a bit. And then really, then what I like to do is comb the other way. So we went this way first, now we're working that way. And you might notice that your clients, it's not so painful when I scrape down, or it's more painful. More painful. Shouldn't be, right? It's the same area of skin. Now I'm going to do the J stroke. Go down and scoop. I'm a left-hander, so it's a bit tough for me from this angle. Go this way. Yeah. Straighten your leg for me. Boom. Down. And when you add in this instrument stuff, what we see a lot is people have many years or months or decades of massage experience, and they forget all the other stuff they do, they only start using this stuff. This should be an adjunct. So if Kiki come to me and she was having knee pain, hip pain, the session might look like, it might start with some of this, trying to facilitate, sort of trying to wake up the VMO. Then we might go to the hip circles like we showed earlier. Then we might release the TFL. Then we may do some internal hip stretching. And I may come back and do the whole thing again. And then the second time round, maybe less sensitivity, more range of motion. So when you're doing a session using a tool, it doesn't mean it has to be the whole session using a tool. We can mix and match. So don't get into the habit of only using one thing. Use your whole toolkit. So working the VMO. With a good tool, you'll notice it has a beveled edge. Has a beveled edge. So when I'm scraping the tool, I want to use the bevel. So it's this way. And indeed this way. So I normally always start just A to B, linear strokes. Here. Then we might work down. So again, I go the other way now using the other bevel, the beveled edge that is. Down. Always focus on this teardrop vastus medialis oblique. Here. Then I like doing the J stroke. VMO, scroll down and J. And the J's can be long, like so, or a bit tighter. A bit tighter. Here, here. J. So with Kiki, I'm feeling a lot of gristle, like bumpiness in here. So we may focus just on that little piece here. So same when you're doing a myofascial release stroke, guys. It doesn't have to be one long stroke. It can be small chunks too. So when I do the small chunks like this, the pressure is here, I release. Pressure is here, I release. So it's not it's not back and forth. It's pressure, no pressure. Pressure, no pressure. Pressure, no pressure. Same if I'm going this way. Pressure, no pressure. So it's not a scraping like this, it's here. Although when I do it in real life, it's maybe you can't see the detail, but now I've explained it. Pressure, release. Pressure, release. Pressure. So it looks like that. But it's this.